everyone has the opportunity to be at their best health. So regardless of age, gender, race, ethnicity, making sure that everything is in place for people to be their healthiest.
Hello, listeners. Welcome to Doc Talk Live. Doc Talk Live is a health show dedicated to educating its listeners about different health topics every week. We do so by bringing on medical experts to answer commonly asked questions. Be sure to send your questions through Facebook Live on Wednesdays at 5 p.m. You can find more information about our show on Facebook, Instagram, Twitter, YouTube, and our website, doctalklive.com. That's doctalklive.com. Also, you can watch more episodes of the show on other platforms such as Spotify, iTunes, and iHeartRadio. My name is Dr. Mohammed Al-Haq, and I'm hosting today's show. So the show is about health equity. Health equity is often cited, it's an often cited goal of public health and policy, yet it's difficult to attain. Joining us will be Dr. Amanda Mohammed and Dr. Victoria Udeze to educate us more about and discussing more about addressing health equity. Dr. Mohammed and Dr. Udeze, welcome to Doc Talk Live.
Thank you.
Thank you so much for launching your time to come here today and be a part of our show. So if you'd like, you can tell the listeners a little bit more about yourselves.
Okay. Well, thank you so much for having us today. My name is Victoria Udeze. I'm a family physician in the Dallas area, and so glad to be here to talk about this topic.
Hi, everybody. My name is Dr. Amanda Mohammed. I'm a board-certified family medicine physician, and I work in the Dallas area as well. And we're just so happy to be here and talk about this very important topic.
Absolutely,
Yeah.
and pleasure for y'all coming on because it's definitely an important topic this day and age for sure. So let's dive right into it. So explain to our listeners what is health equity.
Yes. Health equity, I think, is easier explained than achieved. So it is when everyone has the opportunity to be at their best health. So regardless of age, gender, race, ethnicity, making sure that everything is in place for people to be their healthiest.
Yes, I agree with Dr. Udeze 100-fold. I think that the term health equity is used so much now that people don't realize the background of what it is. And so the context of the definition really goes back to exactly what Dr. Udeze said, like what can make health equitable for all people, regardless of circumstance, right? So.
Absolutely. So in this day and age, why is health equity important? Why does it matter?
Well, I think our families, our societies, our communities thrive when we're all healthy. So if we look back on this year, think about the pandemic, think about the burden of illness on a person, and think about social barriers that are in place. And so when we're talking about why it matters because there are other drivers of health aside from healthcare. It matters because there are other things that determine our health, whether it's where we live, where we work, so our lifestyle, our behaviors. And if we all have the opportunity, if our families all have the opportunities to be healthy, then we have a healthier society, we have a healthier workforce as well.
Yeah, exactly. And I think, as providers as well, it's so important for us to understand and try to tackle these issues. I feel that oftentimes, because we cover so much in a breadth of a patient visit, there's so much detail there, but social determinants of health and body also what health equity is all about. So if we don't address, as Dr. Udeze mentioned, about specifics pertaining to the disparities, then our patients will be left with nothing, and that just continues to not really get at the triple aim for anybody everybody in healthcare. You know, we want a patient experience to be great, we want their outcomes to be great, and we also want to make for sure that the overall cost of healthcare is not enormous. But if we continue to put that aside and not address these issues, we're going to be in the same situation. And I feel now more than ever, just as Dr. Desi mentioned, you know, with the pandemic, there's been so many people in our societies, especially those that are socially and economically disadvantaged, that have suffered so much. Yeah.
Excellent point. So I think you've sort of alluded to these factors, but what other factors, and you can talk about the same factors affecting health equity?
So discriminatory, you know, practices. There is a lot of institutionalized racism, which maybe some are aware, some are not aware, but definitely in certain areas, would definitely speak, you know, for practicing in the Pleasant Grove area, South Dallas region. You know, there are certain people that cannot have access to good quality care. And if we don't go out and make for sure that those people get the attention that they deserve, then that's, you know, something that's going to eventually haunt us decades and generations later. So not only discriminatory practices, but there's housing inequities. There's also different biases when it comes to housing. Being able to have a higher income, you know, bracket that people can live and succeed and flourish, because the wealth gap in this country, right, continues to expand, and the gap between rich and poor I'm alluding to. So those are just a little bit, and I'm sure Victoria can add some more to that, but those definitely contribute to the disparities that we see oftentimes, like throughout our communities and the patients we serve.
Yeah, like what Dr. Muhammad just said, when you think about the definition of health, so we think about the World Health Organization and how it talks about a state of physical, mental, social well-being. A lot of times we think about health and we think about healthcare. So we know what health is. Then think about healthcare, the care that we provide as clinicians, and think about a healthcare system. So when we're talking about equity, we're thinking about the healthcare system as one driver of good health, and then that's about 20% when we're looking at guidelines and consensus guidelines. And then we're thinking about everything else in the community that's affecting a person's health. So those are really important things for us to be very mindful of.
Yeah, keep in mind and be vigilant. Excellent points. What do you think the difference between health disparity and health equity is?
Yeah, that's a really good question, because we are seeing those words around. So when we talk about equity, we're thinking about opportunity for everyone to be healthy, right? So regardless of any circumstance and regardless of societal barriers. Disparities are those differences between populations, so those health differences between populations, and they're usually caused by inequities. And so when we talk about inequities, we're talking about social factors, things that are not like biological differences, why, you know, someone, maybe you have a genetic trait for something. We're talking about social factors that are causing people to have poor access to care than others. So disparities, we're talking about differences in health outcomes for a population, and then when we talk about equity, we're talking about making sure everyone has the opportunity to be at their best health.
Exactly. And I think that, you know, often, you know, it's just, you have to look at the fact that anybody can be born anywhere, different family circumstances, but it shouldn't matter. It really shouldn't matter where someone grows up. What schools, you know, they go to should determine the trajectory for their entire life, right? When you look at even just schooling alone, most individuals that don't have really good schooling and can, you know, make for sure that if they want to, you know, go on to college or whatever type of education they seek, it later on in life will manifest in other ways too in terms of their overall health. And there's been numerous studies that have shown that correlation. So just as what Dr. Desi mentioned, it is very important for people to understand those differences, and they're not one and the same. I feel like the term was coined like in the early 90s as all-encompassing, but it's not that way at all. There's distinct differences from that.
Excellent. So I guess moving into why is addressing the role of social determinants of health important?
I believe it's critical. As family physicians, we are very much trained, in that mind frame, right, to look at a patient holistically, not just from their medical conditions alone, but also seeing the circumstances that got them there to begin with, right? So, if I have a diabetic patient in my office, where are they living? Do they have good access to quality foods? Maybe they're in a food desert. Can they exercise? Do they fear, going outside and walking because there are dogs that may, be, harmful to them? I know that we discussed this in a residency talk years ago. And so there's so many different barriers that we can't assume anything. You can't do that. So one of the practices that I implement at our clinic is from the get-go, when a patient comes in, we discuss their social determinants of health. What are the barriers for them being able to get the quality services that they need, or affording medications? Oftentimes you don't know until you ask, right? So if we don't ask the questions right away, establish that trust, that great patient, physician relationship and that rapport, it's never going to come up. And I feel like, yes, you can prescribe a medication, you can diagnose a condition, but if you don't know the other circumstances surrounding the events that led to that person being in your office, you're not doing them any service.
Right.
Yeah, correct. And just based on what you're saying, Dr. Mohammed, at the end of the day, we want to make sure we're reducing health disparities, right? So that's like our ultimate goal, that we reduce health disparities and everyone has that access to the best health that they can have.
What are some of the barriers to addressing these health inequities
that you described?
I think some of the barriers, I feel that if it's not an integrated part of the system itself, it can be almost seen as a hardship for a provider, right? Because there's so many things to cover in a visit, and at times, if it's not put at the forefront, it can be looked at something as secondary when it should be primary, just like anything else. I do feel that with a lot of the Medicare and Medicaid services over the years, that's been part of the framework of trying to really put at the get-go preventative care, and that's what we're in the service of doing, is prevention. So I know a lot of the plans and even private care plans that do emphasize the need for making for sure these things are reviewed time in and time out. Having a good team, and making for sure that part of that team consists of a medical social worker, also people that are on the grounds in the community and trying to engage. Sometimes we go into practices where we don't even know the community that we're serving, but it's very important to hold and host, even sometimes, I know in the light of the pandemic we haven't been able to do as much, but even events in the area, get to know community partnerships, try to market vaccination drives and things like that through churches and places that people feel really comfortable outside of a clinic environment, and that helps stem even more of the conversation surrounding social determinants and even health inequities.
Yes, I definitely have to agree with you, Dr. Mohammed. Other things that I would add is just the lack of awareness or acknowledgement. So we know that there are social determinants of health, but we still have a hard time with measuring that. We don't have enough data. We don't have enough funding that go into health equity-based research. And even lack of time. Some folks might feel within their clinic setting, I have a whole bunch of things to do. Where do I fit in social determinants of health?
Right.
And so that's why it's very important for what we're talking about here and this show, to highlight even the fact that within your healthcare setting, there are resources for you to be able to promote or to address social determinants of health.
It's a segue. Now, how do we,
promote health equity in our communities?
Yeah, so there are lots of ways, but the few that I'll talk about, first of all, recognizing that they exist, and then knowing what resources you have. So depending on the kind of system you work in, and I'm talking for the clinicians here, you might be working in a system where you have access to a case manager, social worker, behavioral health, a good integrated system. And so you have that conversation within your team, how do we tackle this? versus where if you are in your own practice and you don't have anyone else with you, and then you look into resources within the community. There's a few that I know of. One of them is Aunt Bertha. It's a website where you put in a zip code, your patient's zip code, and it tells you what services are available. It's a free service. Or even calling 211, using some of the Texas Health and Human Services resources, and just knowing what's available where you live and where you practice. There are many community organizations that are willing to work with clinics and hospital systems to help care for the social needs of their patients or their clients.
I completely agree, and I think that so often we don't utilize that community based resources enough, or don't know enough about them. And if we don't, our patients don't, right? So that's why it's also important to bring these topics into discussion. One thing that I was just going to add as kind of a caveat to that too, Victoria, is that patients, unless they're asked, they're not more than likely going to tell you, right? So sometimes there's this hesitancy. If I disclose this to my doctor or other provider, what are they going to think of me? And so there's a lot of stigma, right, surrounding a lot of these social determinants. So we have to really make it a point to have patients that are comfortable enough with us to just have these types of discussions. But yes, to piggyback off of Dr. Adezi from CDC, the AAFP, American Academy of Family Physicians, there's tons of resources to be able to help assist within this, realm that we're speaking about. So,
no, that's excellent. That there are resources that can help providers specifically, and I guess in terms of providers, what are some good ways to reduce unconscious bias? You kind of alluded to that, talked about that earlier. About how can that help us?
Right. I feel like that is such a great question, because we all have certain biases. I mean, if you're living and breathing, growing up in a certain place different from someone else, you're going to have a bias. So I think it's important to recognize it. And when you do recognize it, you have to be able to see yourself from the perspective of the patient. So there are so many different books and resources out there that identify the fact that whenever we're growing up, or even in medical school training, and we see certain things, it becomes sort of a subconscious bias, and that can be very bad for patient outcomes. So recognizing it, I think, is very important. Being more amenable to learning about other cultures, being, in the community, learning more about what's going on in the social circumstances and surroundings helps you connect with the person better, right? Seeing, from their point of view, maybe why they're doing what they're doing, and not, again, assuming anything. There was, many studies about sickle cell anemia patients, for example, and there's so many layers to that, but, going into the emergency room and in a sickle cell crisis, and they need medications, right? But they're judged first for being pain-seeking, and therefore not getting the medication they need, and then there are, so many different poor outcomes because of that. So there's so much there, and if we don't recognize some of the stereotypes that we may hold, it can transcend into our patient care. So
yeah, definitely have to agree with you there, Dr. Muhammad. I think acknowledging and reflecting. A lot of times when we hear the word bias, you think, "Oh, I'm a bad person for thinking this way about someone else." But just reflecting on your thoughts towards a person. I recently heard something from Dr. Williams. He was part of the Institute of Medicine's report on unequal treatment that talked about implicit bias in healthcare, and he had said, why don't we think about counter-stereotyping? So if you think women are weak, what does a strong woman look like to you? And then can you imagine that women can be strong? And so counter-stereotyping is also another way to deal with that, and just making sure that we are educating ourselves, like you said, Dr. Muhammad, on other folks intentionally.
Yes,
intentionally doing that.
Right. No, that's excellent. I
appreciate that insight. What is the role of family physicians in reducing health inequities?
That's big. I think that just in light of everything that we've just discussed, I feel that you are the front door in a lot of ways, right? As a primary care provider, you're really knowing the patient inside and out. So in terms of acknowledging and directing what information that you gather from a patient encounter, it's very, very important to not just let that information, go on deaf ears. You want to connect patients, and you do have to have the support. There are a lot of things that we do day in and day out, but that's why I mentioned earlier, it is important to have a team-based approach to this. Having that accountability to ensure that these things don't get, passed on without any kind of follow-up. And that, I think, having had the experience of following up with patients afterwards about, transportation services, or did you go to that specialist appointment? If you didn't, what happened? They are so appreciative, and it's like, wow, you really care. I wasn't sure what to do in this instance because I thought that if I missed the appointment, then that was it. Just really trying to be reassuring, knowing that you're their advocate, and that no matter what, ultimately everybody's on the same, wavelength of trying to make sure that you get the best quality care. So as a family doctor, I take huge pride in that, and wanting my patients to feel very comfortable with me, my team, and being able to address these things day in and day out is what we have to do. It's an obligation.
Yeah, definitely, Dr. Muhammad. I agree. And the only thing I would add to that is we have a role of educating. So we have the big role of educating our patients, their families, our communities. So we see folks, we deliver babies, we see folks from when they're born to, when they pass away. Right. And so when you have the well child visits, you're educating kids the importance of staying in school.
That's right.
And not using substances. You're educating pregnant moms, you're educating, elderly folks. So we're constantly educating our patients as well and empowering them to make good, healthy lifestyle choices,
right,
and giving them the resources that they need to thrive.
I completely agree.
That's excellent. In terms of what the last year with the pandemic going on and telehealth being more employed and implemented, what are some of the equity considerations that surround telehealth specifically?
I feel like there's so many benefits, right? When we think about telehealth, and especially in light of the pandemic, saved so many practices, and patient care, wasn't something that patients were. I guess most of all, like when it comes to digital media, a lot of patients didn't have the access, right? So, especially working, in areas where Dr. Udezi and I work. It's not common, right, for people to necessarily have the access to internet and Wi-Fi and all the things. And also working specifically for myself in a geriatric population, we're also talking about a certain age group too that isn't as comfortable with using technology. So to be honest with you, I've seen a lot of patients that have suffered tremendously throughout this pandemic, and fortunately now we're trying to come up with more ways to get patients into the clinic in a safe way so that they can have their needs addressed. But it has been pretty challenging. What would you say too, Dr. Udezi?
I have to agree with you with the technology factor, and also, so in addition to technology, I know we're looking at the barriers, but one way that I'll also look at it too, what we've done about it too, is making sure that our clinics are staying open.
Right.
So there's that hybrid format of, for some folks we can, do the whole telehealth thing, but if we're not able to, there's the opportunity for you to still come in, and if you cannot come in, this is where you can go. Yeah. So still keeping that communication line open with our patients has been important, but yes, technology has been a barrier, even just utilizing some of the EMRs. And some of the ways that you can communicate with your patients through that has been a barrier.
Great. I think
there's so much more to cover, and I think we've covered so much to begin with. But I mean, I probably need another show for it too. To be honest, we're approaching the end of the episode of Doc Talk Live. So remember to check us out on Facebook, Instagram, Twitter, and our website doctalklive.com to obtain more information about next week's hot topic and guests. Also, don't forget to like us on Facebook, Instagram, Twitter, and subscribe to our YouTube channel. You can now listen to our podcast on Spotify and Stitcher too. So be sure to send your questions into our social media platforms to get them answered by an expert. So as we're approaching the end of our show, Dr. Udezi and Dr. Muhammad,
anything else you want to talk about, or any last minute information you want to give our guests?
Yes, so we really believe, like you all also believe, in educating our community, and these are issues that are really important to us, making sure there's health literacy and health education. And so we're starting a podcast,
Yes.
hopefully next month.
Awesome.
It's been interesting getting together and talking about how we really want to educate our community and empower them to take control of their health.
Yeah.
So
That's excellent.
We will provide more details on your website.
Oh, that'd be
Yeah.
great. Yeah, so then our listeners and and I'm sure people who are
Sort of moved by this conversation will definitely check it out. So appreciate you both coming on the show, and come back again, because there's so
Yeah,
much
of
more to
course.
discuss. So we appreciate it.
Thank
And
you for
this is
having
us. Yes, we
absolutely our
appreciate y'all.
pleasure. This is Dr. Hike signing off. Stay healthy, Texas.